session? Oh, okay. Come on in a second. Thank you. Thanks. Oh, thank you very much. Okay. All right, we're good.
Let's call this meeting to order and begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America
and to the republic
for which it stands,
one nation,
under God, indivisible, with liberty and justice for all. Let's also have a brief moment of silence, please, for the Portage County residents who lost their lives this week battling the COVID-19 virus. Our thoughts are with their families and loved ones at this difficult time. Thank you. Let's recess into solid waste.
I move to approve the minutes of October 1, 2020.
I will second.
Roll call, Amy?
Vicky?
Yes.
Sabrina?
Yes.
Yes.
Move to approve the October 8, 2020 bills as presented by the county auditor.
Okay, I will second.
Roll call, Amy?
Vicky?
Yes.
Sabrina?
Yes.
Kathleen?
Yes.
Move to approve the October 8, 2020 journal vouchers as presented by the county auditor.
I will second.
Roll call, Amy?
Vicky?
Yes.
Sabrina?
Yes.
Kathleen?
Yes.
Move to approve the October 8, 2020 then and now certification as presented by the county auditor.
I will second.
Roll call, Amy?
Vicky?
Yes.
Sabrina?
Yes.
Kathleen?
Yes.
Move to approve the Board of Commissioners agreed to amend Resolution 20-125, authorizing the sale of obsolete equipment by Portage County Solid Waste Management District by public auction.
Oh,
I'm
Yeah.
so, yeah, I'd like to just simply say I had a truck that during the list I inadvertently left off. It sold, so we just need to add that on. And just a quick update for the board. The public auction brought in $43,350. I was rather ecstatic over that amount. Everything we listed sold and had a lot of bidders. I would have considered a great day anything over $10,000. So Edinburgh Auctions did a fantastic job as usual.
Good. Thanks, Bill.
I will second.
Roll call, Amy?
Vicky?
Yes.
Sabrina?
Yes.
Kathleen?
Yes.
Okay, just one discussion item. The board remembers our contract with our current processor is up November 12th of this year. We received 3 responses, one from Waste Management, our current processor, Kimball, and Rumpke was a no bid. I did a tabulation sheet and real quickly, some of the things that we will see, we will actually get paid for 3 through 7 plastics, which was at no cost before. And our revenue share will increase from 80 to 85%. Unfortunately, in these markets, the markets are still depressed. But if you look at the processing costs are only going to go up to are going to rise to $77. They're currently $57.48, whereas with Kimball, it was going to be $104 per ton. So what I would like to do is I'd like to get the board's authorization to work with Gene and Chris Maduri on getting this contract drawn up with Waste Management. They did offer a 1-year contract. I think that has to do with their lease and the markets. Hopefully the markets will start coming back as more and more paper mills and facilities domestically are converted over to buy domestic product.
You know, I was, speaking of that, when I was looking at, Kimball was gonna do a 5-year lease. Was that price gonna be fixed for 5 years, Bill?
Well, their price for the residue was going to go up every year. And that was, that was another deciding factor. And they're already, almost $40 higher on the processing cost right now. So when we looked at it long term, still the waste management is the way to go for at least right now.
And they're convenient too. I mean, they're not.
Yeah, waste is only, we can make it over there from here 15 minutes and back. So, that does add into it as well.
Thank
And
you.
that's
Go forward.
Yep. All right, then I will get a hold of the parties involved and move forward with that. Thank you very much and have a good day, everybody.
Thank you, Bill.
Thanks, Bill.
Yep.
I move to adjourn.
I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina, Kathleen.
Yes. Let's reconvene our general session, and Job and Family Services is up.
Looks like they're here. Looks like Kelly Jo and Sue's here. There you go.
Good morning, Sue and Kelly Jo.
Good morning.
Good
You're both
morning.
Muted, or you're muted, Kelly Jo.
Yeah.
Can you hear me?
Yep,
Oh, great.
we're ready for you.
Thank you. I'll get started then. My first agenda item is the July-August data report. And to highlight some information there on the first page, our numbers are consistent in the Ohio Works First Cash Assistance area and food assistance. Medicaid does not have data available to us as of last Friday for July and August. So we've been checking the state system daily. And so that hopefully will be on next month's report. Child care, as you see, and again, we're about a month and a half behind. We are continuing to qualify youth. There was an increase of $117,000 in funds expended for childcare. And the question we're trying to clarify is maybe if it has to do with pandemic childcare, and that increase might be associated with some of that. So I don't have the clarification on that increase, but I'll be sure to get that to you next round.
Yeah, because you know what, I had that noted because I'm like, we went down, but yet the increase was huge.
Yeah, and I'm guessing it has something to do with the pandemic childcare. Even though the numbers reduced, there were some special accommodations being made during this time. So, but I'll clarify it because I had the same exact question as you. Page 2, our net transportation. We're continuing to grow back to normalcy from transportation. If you could see, our own drivers in July had only transported 28 or had 28 trips. In August, we had 36, and it's increased exponentially since then, but we're growing back to a sense of normalcy. Our providers have continued to transport to dialysis and substance abuse clinics throughout the pandemic, but other trips are increasing now as well. I think people are feeling more trust, and there's a lot more safety precautions with our transit vehicles, so that's a good sign. Everything else was pretty consistent except for on the bottom in benefit recovery, and that's the team that we have in public assistance that calculates overpayments, and then we move to collect those through either benefit reduction or court action. And so we have been asked by the state during the pandemic to suspend our collection activities, but they did give us an October 1 green light to start. So, and probably December report, you'll see that number increasing, but it made sense for us not to collect from people when people are losing employment and dealing with this financial crisis as a result of the pandemic. So that's why those numbers have been minimal since March. I didn't have any news flashes on the page 3 for Ohio Means Jobs Center unless you all had some questions from that page.
Kelly
Um,
Jo, when did that reopen? Was it in July?
Our Hemmings Job Center?
Yeah.
Yes, I believe so. I
Okay,
believe
that's what I thought too.
Yeah. Then page 4, great news is that we're referring more people to the impact program that we brought in-house that replaced the old passages program. The data doesn't reflect that those people that were referred in August had gainful employment, but I'm following up on that as well to understand, are they doing some training first? And so again, I want to follow up with you next month and I'll reflect back on August. Work experience, our participation rates as required by the state are below expectations, but that's common amongst all counties. Again, pandemic related, either work sites have not had the ability to utilize people in a work experience or we had families that were not showing up to the site. So prior to the pandemic, we definitely were solid with numbers. So page 5, our CCMP, you have a question?
Kelly Jo, on page,
4?
wait, are you on page 5 now?
I flipped to 5, yeah.
Okay, that's where I have the question on that PRC applications received.
Yes.
It's so low.
Yes, in August it was 291. The spike was because we offered the pandemic relief, but we gave a deadline. So we only had a certain period of time to expend or to utilize those funds. And so it reduced in August.
Okay,
July, you see it higher because you remember we offered cash assistance through the PRC program, $300 one time. So that's the
Okay.
difference in numbers.
so it's really July that's kind of off. I mean,
Yeah.
yeah, okay.
And we did, and we haven't received a response yet formally, but with the CARES relief memo that I sent, I asked for consideration for funds to be able to provide a similar benefit to adults without minor children because TANF has to be tied to families with minor children. So if that rolls out, again, it won't be PRC per se, but it'll align with our PRC plan and we'll track those numbers there. That might be an increase that we'll see if that gets approved. And then on page 6, did I skip? Children's Services, the header is gone on mine, but the Children's Services data was next. And at the end of August, we had 229 kids in care. To date, we have 209. And it reports in August that we had 14 kids in residential treatment. To date, we have 10. And so I'm sorry that this is always a month and a half behind, but with the state data, it reports behind. So I don't know if you had any questions with child welfare.
No, but those numbers are still so high, you
Yeah.
know,
Yeah.
compared to what we used to see.
Yeah, 2015, I hate to go back, but that was again pre heroin epidemic was 169 was our average. So, and then we saw the highest, if you could remember a couple years ago, 269. So we're in between the two, but definitely substance abuse has not gone away. Even with the youth that we're receiving custody of from juvenile court, majority of those youth have substance abuse issues, parallel to their parents that are struggling with addiction as well. So we're seeing it more now, I think, than we were several years ago, especially for our teenagers. Just wanted to add that piece to it. And then child support, real consistent with everything going on there. And then our employee numbers, 194 as of August. We're at 193 now. I believe pre-hiring freeze, we were right at 200. So we're maintaining with 193 staff, and I appreciate you guys approved a few staff for Children's Services. So on behalf of them, I know they're grateful just because of the maintaining caseload sizes. So that's all I had on the data report, unless you had other questions or follow-ups for me. And I'll be sure to circle back on those two areas the next time I report out.
Okay,
Kelly Jo, it looks like you're planning to do some type of job fair event. I assume that is like a virtual event. And
Yes.
what's the
social media.
target date on that or
Did
time
you
frame?
did you get the flyer that was presented to you all? I was going to present it next month, but can I text Mandy and ask her the specifics?
Yeah,
Well, it
We-
sounds like it's coming up. So that's good. I
Yeah.
don't think I saw the flyer.
No.
It might be in
You
our
might
staff
have it
meeting
up there
today.
with you. You might have it up there with you this week. There was Ohio Start flyer that we sent up to you. That's a new initiative, and the virtual job fair flyer should be in your folder upstairs.
Okay.
But I'll clarify. I'm texting her now before the end of my session.
It's up front. Mhm.
it was
Oh, you
brought
have
up
it up front,
yesterday.
Amy?
What'd you say?
You said it's up front?
Yes,
Okay,
the blue folder. Mhm.
okay. I'll get you more detail though before the session.
Yeah, Mandy brought it up yesterday at NotCog that,
Okay.
yeah, that you were going to be using the social media platform versus any of the programs that the state had. You guys sort of created your own
Right.
now.
And we've been doing, since the pandemic, that we've had that same system as far as virtual. They just are targeting it as a job fair now, but we've been recruiting and utilizing virtual means with our employers since the pandemic. And it's just been really successful. That's a new normal for all the Ohio Means Job Centers in Ohio, the virtual platform. As Commissioner Bennett said, some are utilizing some state platforms, but we've been doing it since the onset. So we, if it's not broke, why try to fix it? So it's, but I'll get the flyers up there, and then again, I'll get you, but it's going to be a continuum too, not a one and done. We're just kind of kicking it off just to highlight it, but we've been working on this for months. So they do an excellent job. I'm going to present to you in November a new program called Go For It. It's a pilot project for this state, and it's a new case management program where it really uses a lot of empowerment techniques for our work with the clients in Ohio Means Jobs. And it also gives a lot of skill sets to our staff. And so Portage was selected as one of like 5 pilots in the state to participate. So I'm really excited to present that to you all, bring Mandy on in November. We're just now completing the training for it. So it works in tandem with us working with individuals to get them employed and also to help them build skills.
Hey,
Great.
Kelly Jo, I had
Yeah.
in my notes that it was the week of November 9th.
The job fair.
Yeah.
Yeah. So November 9th, Sue said.
Thank
Okay.
you.
Okay, AFSCME update, or AFSCME 161996 update. So with the hiring freeze, with the budget reductions surrounding Protect Ohio, state and federal reductions, we've had conversations with our union. They've been wonderful, and we were supposed to start negotiations. We do IBB, so typically we start in August, so we're a little bit behind. But I had an opportunity, Sue and I, to talk to Steve Pickard, who's a union rep in Akron, and then our president, Jared McIntosh, about 3 weeks ago. And we just really talked through where we're at Portage JFS. And I had posed to them a 1-year contract for 2021 and talked about the fact that, our financial situation in 2020 isn't great, and asked if they would consider moving forward with a 1-year contract with no financials. And if we have other issues to discuss, we could work through those, like through the IBB process, and then maybe move forward in 2022 with a full 3-year contract. And so they discussed it with their board, and they support it. They do have to move forward to talk to their union body and get a formal vote, which is why I'm not in executive session with this. There's nothing formal been decided, but I just wanted to give you a heads up that we've had conversations, and they had shared with me they would get back to me by the end of October. So at my November session, I'll have more to report on where JFS is going to go relevant to negotiations. But at least, again, we've had conversations. It just really, we did some things with flex time. And so they really just appreciate our management's efforts to with teleworking to support staff. And so I'm really optimistic that we'll be able to come to a solidified resolve on our contract negotiations. So that's all I had with that. Did you have any questions?
No, but that's great, Kelly Jo. And, we're grateful to them for their willingness to be so flexible in this time that we're in, and for your leadership and kind of steering it in that direction.
Great. And that, and not to slight any other system, knock on wood, we don't face that. But I think too, the reality is our union recognizes some counties have had to lay off staff, unfortunately, during these times. And so I think they're, again, really humbled and appreciative of our transparency with them. And so it's good. It's good to have open communication. So I'll keep you updated. I just wanted to give you this initial update following our recent meeting.
Thank
And
you.
then, you're welcome. The next item is foster parent licensing, and this is just a discussion. We had an employee several weeks ago that outreached to me and asked about the possibility of our employees becoming licensed as foster parents. And so historically, Portage County has not had that as an option. And a couple of my home finding staff believed it wasn't a possibility. But in consulting with the state licensing, they advised me that it is possible. We just would have to build the policies and parameters around it to reference conflicts of interest and those kinds of things. So I'm really eager and open to the idea, but I did not want to move forward unless the Board of Commissioners supported that. Of course, I would draft policy and get it blessed by the state before I would present a draft to you all. But would there be any reservations from any of you in us moving forward with looking at that as an option?
How common is that, Kelly Jo?
I'm sorry.
How common is that?
Well, I can speak from only my personal. When I was in Stark, we did have staff that fostered. Again, they cannot be connected directly to the child or the case or anything like that. But I don't know from an 88 county perspective how many. I guess I could pull some of them, but I do know that it exists in other systems. And we're a quadruple combined agency. And so I don't see any reason why, again, somebody in child support who has a desire to help children, that was an example, couldn't become licensed and be a partner with us in parenting. I mean, of course, that anybody that decides to become licensed as a foster parent has to have the training, and they're subject to home visits and a lot of scrutiny, but that's just to ensure safety of our kids. But I think if people walk in this from our agency with willing hearts, I support it. I think it's a great thing, especially in these times when we're trying to increase our foster parents and our foster homes in Portage. I think the fact that we have staff that know our system and are still willing to step up, I think is great. So
Kelly,
that's my 2 cents.
is there still quite a shortage for foster parents?
Yep. And we're going to talk about, not shortage. I'm going to talk about our recruitment efforts, but still we would love to see more people want to foster teenagers.
Yeah.
So I think that absolutely, Commissioner, yes, there's a shortage in that area. So when the beginning of the year started, I was going to come before you and talk about possibly increasing the per diem rates for our foster parents and maybe some additional incentives for those that were fostering kids with special needs or teenagers. But of course, the pandemic hit and our budget is in a strained position right now. So I'd like to revisit that when we get to a new normal and when our budget is balanced in 2021. But in the meantime, we do have some efforts, at least I'm going to present to you in just a minute, to try to continue to increase our numbers as far as licensing. We're in the mid 40s right now. When I came to Portage in 2015, we were in the low 30s. So we've increased. It would just be really nice to continue to increase those numbers.
Yeah. Okay.
Kelly Jo, is it prohibited right now, or is there just not a policy in place?
It's not prohibited and there's just not a policy in place.
Okay.
Yeah. Would you support me moving forward and drafting a policy and then representing it in a few months to you all? Again, after getting the state's blessing on the content of it.
Yes.
Yes.
Okay. And then that moves into the recruitment efforts. So it's timely. So we are going to do a number of different things surrounding mostly virtual. But there's like 4 bullets in there, but we're going to update our marketing materials. We're going to draft some posters and create some informational videos. Kim's really ecstatic about working with Children's Services to create those videos. And then, of course, we'll use social media outlets to promote foster parenting in Portage County. We've always used billboards, and again, because of funding constraints, we're going to look at utilizing those in 2021 instead of 2020, but start with the virtual videos and marketing materials right now. We also did start a faith-based initiative several years ago where we went out and spoke to congregations about the value and importance of foster parenting. And so we're just going to increase that initiative, make sure that we've connected with all of the churches and synagogues in and around Portage to promote foster parenting. And then virtual meet and greet. So we're going to do, again, before COVID, we're going to use Read Library to have some informational sessions available to the residents, and then that didn't happen. So we're going to do this virtually, but same concept is to promote educational sessions where people can come and learn and ask questions about foster parenting. So when that calendar is developed, I'll be sure to present it to you all specifically. And then we continued to be asked to go out to the community and speak, but we will outreach ourselves and ask, kind of push a little bit and see if we can get out to some organizations and speak more. And so those are just highlights of what we're going to do. A little bit different than what we wanted to, but we still want to continue on with these initiatives to increase Commissioner, the numbers that we have in Portage. And that's it for that. Did you have any questions?
No.
Okay,
Kelly Jo.
thank you. And then the next surrounds our group home. So Family First Federal Act is around the corner. President Trump signed this into legislation a few years ago, and October 2021 is the rollout date. And one of the pieces of this legislation, it requires residential facilities across the country to have 24/7 nursing assistance available to all residential facilities. And also it requires facilities to have detailed plans on how they are working with youth and stepping youth down so that residential facilities are not homes of these children through the duration of their placement with Children's Services and Job and Family Services systems. Another piece of it is a lot of wraparound family supports that's aligned with this act. And so we need to decide as a licensed group home with the state if we're going to move forward with those requirements, because if we don't, in essence, we would not be able to receive the funds and through 4E and other things that are aligned with being under the umbrella of this act. So first, I did outreach to the owners of our group home, that own our group home, the home that our group home is in, and really explained to them again our financial constraints this year. And we had talked about being able at some point to possibly purchase the home, or you all would purchase the home with our funds instead of leasing it. But that's not a reality for us. And so the executor of the family consulted with the family, and they said they would be willing to engage in another 2-year lease with us. So that was important to know that before we move forward with anything. And then what I need to do is to begin to start the accreditation process, which is a lot of paperwork. And it really is compliance related and making sure we have best practices in our group home, which is an excellent thing. It's just going to be a tedious process. There's a couple $1,000s associated with the accrediting body. We have to pay for this. The great news is that Ohio Department of Job and Family Services just disclosed that there's grant opportunities for systems to cover those costs. So it really, at the end of the day, it would be us paying from our budget, but asking for reimbursement, which is our reality with everything anyway. So, but that's great news that we would be able to have that few $1,000s covered by state funds. And then the 24/7 nursing piece, I've already outreached to a company that number of agencies use, specifically Trumbull County Children's Services. And so that seems very simplified, and it's an excellent to have that to be able to. We've been using University Hospital and Access Point when the kiddos at the group home might have some medical stuff. So being able to have a nurse available for consult would be really great for us. So really those three things are what gets us into the place of accreditation. We have to be accredited by October 2021 to be able to, again, receive the funds linked to and reimbursements, residential placement. So I'm seeking your support to move forward. Our new program manager is Kelly Swigart. She started this Monday. It's part of the job description. And so she and I will be working a lot of evenings and after hours to do this, but I think it would be wonderful to have an accredited group home in Portage County. So I seek your support in moving forward on those initiatives.
Yes.
Kelly Jo, will the person working in Todd Pete's office, the grant writer, be able to help you with this?
I would love that. Although it's not, she has some associated or the line that duties as assigned, but we've been unsuccessful to date. She's written about 4 grants for us and we've not been approved any of them. So it would be really good for us to maximize our contributions to her salary to pull her in. So as long as there's no objection and we are paying for a portion of her time, I think that's an excellent idea.
Right.
And so thank you for bringing that up. I really didn't think about it until you said it, but that would be an excellent use of her time
Okay.
with us. So thank you for that. Yes,
Sure.
absolutely.
Thank you.
The last thing under the group home is there was a draft job description that I submitted to you for a part-time position for the group home. There are 2 things that are different on this description as opposed to our full-time is, of course, the word part-time. And then in the back part of the job description under the job standards, it says that candidates pursuing a degree in a medical or social service field would be considered. The secondary section is what was in our other job description. I met with the union on this. They knew I was proposing this to you all today. They voted and they support this part-time position as long as we're not trying to supplement full-times for part-times in the future, which I understand. But the baseline for this is with holidays and even the pandemic, we've had to pay overtime in a number of different scenarios. And I think we could maximize the time that we need spent in the group home by paying straight time versus overtime. It would not be an increase in our costs, and Sue can attest to that. She's on the phone because we have budgeted about 12 hours of overtime every pay period anyways. But again, we've had a couple of medical scares. Holidays are amongst us. People want to take vacations, and this group home staff have been stellar during this pandemic where kids were removed from school and kids were in the group home in a lockdown for the last 6 months. The workers are saints because the kids have had a lot of distress lately. So this just is a continuum of best practices to be able to have a floater position that can cover and step in to help us to have the best residential system possible. So Sue, I could defer to you if you want to talk about it, but definitely it's not going to be an increase. And if you have questions, please feel free to ask me. But again, I propose to you adding this part-time position to our union body that has been approved by the union and posting for this position in the near future. Sue, do you want to add anything?
Yeah, I was just gonna say, it definitely, when you're paying overtime at 30 some dollars an hour, that adds up very quickly. And if we could, just like Kelly Jo said, get somebody in that could cover those, those shifts where somebody's already hit their 40 hours for the week and then somebody calls off sick, it would truly, we would get much more bang for our dollar. And then, our current workers that are there would be, less strung out, because they're getting asked to bring in, they're just getting asked when somebody calls off, maybe they just came off of a 12-hour shift, 10 hours ago, and we're going to ask them to do it again. So I think it would help all the way around.
Well, also with this job description, I noticed that you also would consider people that are pursuing degrees, whereas aren't all your workers now licensed social workers? So there's
Yeah.
a difference in what you're currently paying preferred to. This would be ideal for some college student to have on a resume builder and get experience.
That's exactly why we added that new line to the part-time position, because we're not going to get people with full-time jobs looking for a part-time job.
No.
But we're going to get, with Kent State right in our backyard, we're going to have medical students and so human and family development students that might want to supplement and work during school, that
Yeah.
they could, up to 30 hours without us paying benefits. But that's exactly why we added that to it. And it's a good opportunity for us to build broader relationships with our universities too,
Okay.
So would you support us moving forward with this
Yeah.
as well?
Yes.
Yes.
I'm sorry. I've come to you with all these asks today. I apologize.
They're all good asks, though.
Okay, good. Well, I think I'm actually done, except for the fact I'm just going to lead into the first of two resolutions. And so just from a Help Me Grow perspective, I'll just share with you a little bit. So I am the chair of the Family and Children's First Council. I don't know why they nominated me, but I am. But Job and Family Services is also the administrative agent and the fiscal agent for this council. And so Help Me Grow is one of the programs contracted under Family and Community Services that aligns with this council and providing these necessary and important services to kids following birth, family supports and those in-home family supports and those things. So that's just kind of an overview of our alignment. Help Me Grow is not a job and family services program. It's just we are the admin and fiscal connected. So I'm going to mic off and let Sue lead into what we've been doing and why she's going to propose to you a cash advance.
So this is actually the second resolution that we have. So hopefully you guys are okay with going backwards.
Sure.
Okay, so the history of this grant, just as Kelly Jo said, we are just the fiscal agent and the administrative agent. So we pretty much, do the paperwork and the money comes in and it goes out. And we, in the past, have always had a little bit of issue with our budget because of contracts that overlap each other, and because our providers, it takes a bit for them to get an invoice to us. Then we have to enter the invoice or the expenditure into a system through DODD, and then we get a reimbursement, and then, then we can move on. Always in the past, we have, when we get ready to do our new contract, which is a state fiscal year contract, so July to June, the county has always allowed us to just encumber what we know we'll be able to expend in that year. So at the most 3 months of a 12-month contract. This year, mid-year, maybe spring, I'm not exactly sure when it happened, but the county decided that we were not going to be able to do that anymore. They wanted the full half a year encumbered for this new contract, even though we're not going to be able to pay it. So what this did was it put us short in our budget. So we don't have enough budget to encumber the full contract, the full half-year contract. So to be able to cover that, we are going to need a cash advance so that we can show the revenue in there then we can increase our revenue certification, which will then increase our expense certification so that we can put the new contract on the books and we can actually pay our provider for it. So any questions? It's a little confusing.
You did a very good job, Sue. Thank you.
Okay.
And we did not want to presume that you would be ready to pass a resolution today, but just in case you are, Sue drafted it. We did want to present it to you so you could ask questions. So I don't want you to think we are before you arrogantly, asking for money if you want to defer this until a later time. But it is a bit time sensitive. But again, we did attach a resolution in case you wanted to move forward.
Kelly Jo, you are the least arrogant person I've ever met.
And Sue,
Please.
just to reiterate, this is a cash advance, so we will get this back, correct?
Eventually, but it's one of those, it's sort of a placeholder, that I know you've done them for other reimbursement type grants, just to free up enough budget so that we can get our encumbrances out there. So we wouldn't ever touch this money. It's just there to help free up our budget.
Okay.
Move that the Board of Commissioners agree to a cash advance of $70,000 from Fund 0001, General Fund, to Fund 1412, Help Me Grow Fund.
Okay, I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
Okay, and then the first one, but the second one is one of our regular transfers from the WIA fund to help cover the shared costs that they incur. This is a second adjustment for July, first adjustment for August, and then September.
Move that the Board of Commissioners agrees to transfer $21,854.88 from Fund 1413 WIA Fund to Fund 1410 Public Assistance Fund.
Okay, I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
All right, that's it for me.
Thank you guys so very much for all your support and wishing everybody a wonderful day.
Thank you.
Thank you.
Bye, everybody. Have a good
Bye.
Safe. Moving right along here.
Hello.
Joanne with
Hi,
us.
Joanne.
Morning.
Good morning.
Morning,
Alrighty.
Joanne.
We are ready to roll today. Let's see.
All right.
The first resolution I have is MOU between Common Pleas Court, Adult Probation, and Mid-American Court Services. They are going to, of course, due to the COVID, way they want to reduce the risk of spreading any COVID into our jail. They want to use this company to do some GPS monitoring to track their offenders versus people having to come in. It's $9 per unit per day, and this is something that they're going, that we can use the CARES funds for, that will take us through the end of December.
Move that the Board of Commissioners agrees to enter into a memorandum of understanding between the Portage County Courts of Common Pleas, Adult Probation Department, and the Portage County Board of Commissioners and Mid-American Court Services, LLC.
Okay, I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
Okay, the second resolution I have is to declare obsolete and authorize the sale of 15 vehicles that are no longer being used within our county. We have sent them off to the Edinburgh auction. They will be auctioned online because that's what they're doing now. And this is just giving you the list of the ones that we are getting rid of. Majority coming from the Sheriff's Department, a couple prosecutors' old vehicles, some undrivable due to crashes and things like that. But these are all now ones that are obsolete, can't be used, and we're freeing up some space out at the sheriff's office by getting them sold.
Move that the Board of Commissioners agrees to declare obsolete and authorize the sale of vehicles by public auction.
Okay, I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
All righty, we have the Valley Enforcement SWAT group that would like to use our training facility out on Coit Road. This SWAT group is made up of the following agencies: Bainbridge, Chardon, Russell, South Russell, Gates Mills, Hunting Valley, Chagrin Falls, Bentleyville, Moreland Hills, Pepper Pike, Solon, Woodmere, Reminderville, and Warrensville Heights, just in case you were interested.
I was.
Wow. Well, all I can say is I'm glad we get good use out of that facility because we get a lot of these license agreements to use the facilities. That's great.
Yeah, we have. It's been a benefit for us for sure.
Move
Okay.
that the board agrees to enter into license agreement between the Portage County Commissioners and the Valley Enforcement Group SWAT.
I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
Okay, and then there was an add-on that came a little bit late for the CARES group. This is an agreement between the commissioners and NDS, who are going to administer some of the CARES Act funding that we'll be able to use for providing small business assistance that qualify, and then assistance to landlords with tenants behind in rent. They have graciously helping us, utilize the money while we have such deadlines. And that's why this is coming to you as an add-on, because we want to get this program started as soon as possible so that we can utilize the funds.
Okay.
Move that the Board of Commissioners agrees to enter into an administrative agreement between the Portage County Board of Commissioners and Neighborhood Development Services, Inc. for the administration of CARES Act funding.
Okay. I have a question. Now, this is also for businesses. Will this replace the Restart program we started that really hasn't? I mean, this is more of a grant. Is that correct, Joanne? Versus a loan, these funds? I mean, they don't have to be paid back is my question.
I believe so. Jean,
That's
can you chime in
Yeah.
on that?
Yeah.
Meeting the abilities provided in the CARES grant documents from U.S. Treasury, it is a grant.
Good.
As long as it shows that the business lost due to the COVID, that's the only stumbling thing they have to jump over. So,
So
yes.
I think we need to revisit the program we started early on, the Restart program that we set aside funds for businesses, but it was set up as a repayment. And Jean, you might want to touch base with Jim because the last time I checked, a lot of people didn't qualify, or once they found out it was a loan versus a grant, and we still have those funds set aside that maybe we could utilize for something else.
You're absolutely right.
Okay.
Spot on. It was
Yeah.
the desire to get a grant and not a loan. Those people who did discuss the topic, they were afraid, okay, that helps me for 3 months and now I owe the money and I got to close
Yeah.
the business. So the grant works well right now.
Thank you.
I'll check on it though.
Okay, thanks. Okay, I'll second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
Okay, thank you all.
Thank you, Joanne.
Thank you, Joanne.
Bye-bye.
Bye. You have Todd coming in at all?
I just sent him a text. We're a couple minutes in front.
Yeah.
You did receive the email from him earlier?
Yes, the bill
Yeah.
run.
Right.
Yep. We're getting those early. That's good.
You want to go with the first resolutions that are just normal? I mean,
Let's give them a minute. That's okay.
no, sure.
Yeah, we're ahead.
He's in.
Todd?
Morning, Todd.
Good morning. Are you guys ready?
Yes,
Okay, and you got the email with the bill run?
yes.
Yes.
Nothing out of the ordinary on it. $1.2 million is fairly normal. Bill run, no late fees, which is a good thing. The then and nows are back down where they should be. So nothing there. And then the budget amendment, we're going to start seeing a lot more of these here. It's just that time of year. But most of those are just to set projects up so that they can be finished up here for the end of the year.
Move that the Board of Commissioners agrees to approve the Thursday, October 8, 2020 bills, ACH payments as presented by the county auditor and reviewed by the Department of Budget and Financial Management.
Okay, I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Yes.
Move that the Board of Commissioners agrees to approve the Thursday, October 8, 2020 wire transfers for health benefits as presented by the county auditor and reviewed by the Department of Budget and Financial Management.
Okay, I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
Move that the Board of Commissioners agrees to approve the Thursday, October 8, 2020 journal vouchers as presented by the county auditor and reviewed by the Department of Budget and Financial Management.
Okay, I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
Move that the Board of Commissioners agrees to approve the Thursday, October 8, 2020 then and now certification as presented by the county auditor and reviewed by the Department of Budget and Financial Management.
I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Move that the Board of Commissioners agrees to amend the non-general fund 2020 annual appropriation resolution number 19-0948 adopted December 19, 2019.
Todd, do you have any comments on this?
No, again, most of it, just JFS trying to move some money to meet where their actual expenditures are occurring. Similarly, the engineer is moving a little bit of money to finish out some of their projects here, as they wind down their paving programs and whatnot. And then there's 21,000 out of the revolver. That is for the Manaway elevator that has finally been finished. All the inspections have been completed, so we are reimbursing Manaway. I believe that was approved in 2019,
Yes.
that we're going to reimburse them for a certain portion of that. So that's setting that up.
Actually, that was 2018. That
It's
project
been a while.
was long coming because Mike Kerrigan
Yeah.
was still here. Yeah. Okay, thank you. Okay, I second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
Move that the Board of Commissioners approve the September 2020 adjustments to the Portage County Water, Portage County Sewer, and Streetsboro Sewer billing accounts as reported on the adjustment reports submitted and reviewed by the Department of Budget and Financial Management.
I will second.
Roll call, Amy?
Vicky,
Yes.
Sabrina,
Yes.
Kathleen.
Yes.
Hey, Todd, before you leave, I have a question. We have a resolution authorizing the document fee set aside for the Portage County Recorder. What exactly is that? You see that resolution?
Was this the Portage Homes one? I've lost track of where things are in terms of getting onto the agenda.
This one came
Um,
in late, so it didn't get on the agenda. And I think Julie put it in the packet before she saw an email from me saying, let's just hold it till next week.
Okay.
So I had the same issue. I just wasn't sure this was a standard thing and thought, let's let's not add it on late and let's wait a week and look into it. So Todd, if you could just take a look at it and for next week,
Yeah, no problem.
give us your take on it. I didn't remember this in the past, so I'm sure it's standard. I just
Yeah,
would like to know a little bit more.
thanks.
So let's
Yep,
skip
no problem. I'll
that.
get
Okay,
response.
all right. Thanks, Todd.
Thanks, Todd.
Have a good day.
Too.
Move that the Board of Commissioners approves the October 1, 2020 regular meeting minutes.
Okay, I will second.
Can you guys give me a second, as usual? Ah,
You printed both sides.
got it. I did both sides again. Roll call, Amy.
Vicky,
Yes.
Sabrina,
Yes,
Kathleen.
Yes.
Move that the Board of Commissioners acknowledge receipt of the September 28, 2020 certificate of the county auditor that the total appropriations from each fund do not exceed the official estimate resources for the fiscal year beginning January 1, 2020, as presented by the Portage County Auditor's Office.
okay, I will second.
Roll call, Amy.
Vicky,
Yes.
Sabrina,
Yes,
Kathleen.
Yes.
Move that the Board of Commissioners receive the September 29, 2020 amended certificate of estimated resources for the year beginning January 1, 2020, as submitted by the Portage County Budget Commission.
okay, I will second.
Roll call, Amy.
Vicky,
Yes.
Sabrina,
Yes,
Kathleen.
Yes. My bad. I didn't realize this was on here later in the agenda, but again, let's just hold it until next week on the recorder.
okay.
And then Jean, I know you have a couple of items. You're up.
Yes, thank you. One is the Lakeside Sand and Gravel. The prosecutor's office has reviewed this and is in agreement with the board executing it if the board feels it is the right thing. And given knowing what's going on out there after meeting with both the sheriff and the owners of the adjoining property, I do not believe this will impact water resource or the sheriff combined use of the property out there. So I would support this.
Okay,
Move that the Board of Commissioners authorize accepting the 50 feet adjacent property request from Lakeside Sand and Gravel, Inc.
I will second.
Roll call, Amy.
Vicky,
Yes.
Sabrina,
Yes,
Kathleen.
Yes.
And another item that would be a requested add-on is really discussion and direction. And I have both Dan Young and Ryan Shackelford here to talk about the dispatching for the communities of Hiram PD and FD, Wyndham PD, and Community EMS. They're getting extremely anxious up there because the end of the year when Aurora will no longer dispatch for them is creating some concern. So what we're really looking for is direction and an agreement on the process by which we would actually sit down and negotiate these agreements. If you have a few minutes to entertain both Dan Young and Ryan Shackelford, I don't see the sheriff being available right now.
That's fine. Thank you, Jean. We see them, but don't see video.
Ryan and Dan there.
I don't see myself on the camera. So
Okay.
that's strange. I didn't know
Don't
if
see
I was
you either.
We hear you.
yes.
Uh-oh.
So what is the sheriff's take on this? Because he's currently over the 911.
We have had several conversations with the sheriff, both Ryan and the sheriff's employee, Dan Young. I think his bottom line position is they're answering the 911 calls, the true emergency calls, and there will be an increase. Nobody knows how much in calls that are non-emergency related that would go to the police and fires departments represented. But he generally believes, I think, that they should stay within the county. And the reason for that is the 911 network will route those calls to the sheriff's office regardless of who's going to transfer and receive that call. So I believe truly he does support this. He wants to keep it within the county. Dan?
Dan, you're muted, I think. I mean, I
Sure.
can't hear you.
How about that?
There you go.
There we go.
Perfect.
All right, let's try it again. Good morning, everybody.
Morning.
Kind of like Gene said, as we promised last meeting when we met with you guys, we're coming with a formula, the best that we came up with, mainly because it's based on fact and we can explain it versus some of the other communication centers that I researched on how they came up with pricing for dispatching services. Let's see. Did you want me to try to pull this up, Gene? Oh, he's muted.
You're muted. Gene.
Yes,
Okay, let me see here.
you should be able to share from your end.
All right. Okay, did that work?
Yes.
Yes.
Okay, I don't know how well you can see it or how zoomed in it needs to be. But this is basically where we're at. So we're starting off with
Can you make it a little bigger,
a
Dan?
little bigger. All right. Ooh, maybe too much.
There we go.
Is that good for everybody?
Yeah.
Just
Yeah.
move around a little bit. Okay, so we're starting off with basically the dispatch budget for the center itself, how much it actually costs to run just the center. So we came up with this figure right here. We're breaking it down between law enforcement and then the fire and EMS, as seen over in this column here. So all of our law enforcement's up top. Just because they're on the list doesn't really mean anything other than those are just players in the county. So we're not gonna go too far into that. Fire and EMS is at the bottom here. And it's a really neat tool that Gene pretty much helped us develop. You plot in your population and it basically gives us the number, equally spreading out the dispatch budget across all the players involved. So is Ryan in there?
This is example only, but Dan, go ahead and type in Hiram Village, just so they see the change.
So they've got a population of 1155. As soon as I tab over, they will take, away from 100% of the sheriff to being, now he'll have 98.38 with them covering 1.62 of the law enforcement side of the budget. And that's how we kind of developed that number. Same applies with fire and EMS.
So basically what it does is it takes it looks at their per capita and then matches it to the total sheriff's office budget that he currently uses to run the center. And then based on their per capita of how much where the originating 911 call comes, it gives that 1.62% of their population is a part of the $1.3 million that they already answered 911 calls to. And then it assigns it based on their population, 1.62% of 90% of the budget, which is considered law enforcement, which is 1.170, now equals what we would request from Hiram PD to dispatch for them based on already receiving their 911 calls, 18,983. So obviously we're talking theoreticals, but that is kind of how we did this formula versus just charging per call, which is what you typically see across the board. And what's nice about it also shows that the sheriff's office from a law enforcement perspective serves already 70,000 individuals in the county, and 90 or 100% of that is already consumed in 1.3. So it not only does it show Portage County's commitment and how much we are spending to run our center, but it also shows by taking on these different entities, what portion they take out of the total budget because we already received their calls. So it really does show commitment from both entities. And then like Dan said, is based on fact.
How does that compare to what they're currently paying to be serviced by Aurora?
Right. So that is actually extremely close. If not, I believe that's a little bit less than what Aurora was charging.
Mm-hmm.
So from the fire and EMS side, the formula might be a little with those, you see those DIV/0 exclamation point. I'm not sure if the formula got a little error message in it.
It's waiting for data, Brian.
Go ahead and type
Anything in there
Atwater for me.
I'm sorry.
Type in Atwater. See what it does. Okay. So right now, if Atwater, because we do not serve any fire and EMS, so if Atwater was to come on, you're going to see that their budgetary number, which is 10% of the total budget to run a 911 center, is 130,000 to the right of column of row 19. Go ahead and type in Garrettsville Freedom. So Garrettsville Freedom serves a significantly larger population than Atwater. So you see that based on the population, as more customers come on, they start sharing the cost of the dispatch center. And now watch, type another one. And then it continues to drop.
Mhm.
And go down to Suffield, which is one of the other couple key partners right now. And it drops even more.
Gotcha.
So right now, I think Atwater was one of the few that was a little bit of an increase from where their current dispatch center our charges are. But based on the services they're going to get, as well as their originating 911 call starting in the center, as well as all the certifications the sheriff's office has to meet in state standards, I think it's a lot better deal overall for them to come to the sheriff's office, as well as the constituents that live in Atwater Township, to receive better services, public safety wise. So it's a really neat formula. I think if it does grow, which we're assuming that this may happen in 2021, we'll have to adjust the 90 and 10% percentage rates that you saw at the top. But most of these are very, very close to what they're being charged now, if not better. Based on the actual budget that the center currently obtains. So it's nice to see it offset the cost of the sheriff's office to run his 911 center, as well as drive in revenue. So as we're observing this in the future, and I'm speaking on behalf of the sheriff's office, my apologies, but as they are observing it in the future, now we may have revenue. If we are seeing an increased call volume or maybe staffing issues, we do have some revenue to possibly meet that need. But that's not expected currently because we're already receiving those 911 calls.
A couple of things in the model. One, it's based solely on the fact that everybody has access to 911. It's not that you call or don't call. It's that when you dial 911, somebody's answering the phone, and in this case, the sheriff's office. Hence, that's the reason the per capita population is used. The other piece, the law enforcement versus the fire EMS, the 90-10 is a good estimate, but what makes this a unique finished product is every year an analysis can be done backwards and then adjust the formula. What we're hearing from some of the communities that want to come on board is they need to know what the budget amount will be looking forward to the next year. So for 2021, Hiram Village Police Department needs to know that their cost is $18,983. We can tell them that with the model. It only goes down by adding more people. So any community comes on later, it decreases the cost to everybody that's currently here.
Well, and here's the other thing. If you're adding on this many people, you're going to have to increase, I'm assuming, dispatch. So is that taken into consider, or the number of people that you have working dispatch?
I'll let Dan address that more fully, and that's been part of the discussion. But again, if let's just say everybody that's in an unincorporated area comes on with the sheriff's office and they need to hire maybe 2 or 3 more dispatchers. Don't know what that number is. It would be analyzed to prove it. Then the 1.3 goes up to represent that, and the share goes back to everybody.
Yeah, correct. So based on what we're looking here and what research I've got, we can comfortably accommodate these agencies, mainly because my dispatchers are already the resources are exhausted by taking these agencies' original 911 calls. We're still basically getting the same information before we even transfer them to the final destination dispatch center. So I don't see that there's any increase in that. But like Gene said, if there was a reason somewhere down the road in a year or so that we needed to hire another full timer, you're still splitting that cost. You're not just looking at the sheriff and saying, hey, we need to come up with another however much a full-time dispatcher is, that you're still going to share that cost. So
I want to have 100% visibility. So the village police departments are a little different, kind of similar to you see with Brady Lake. So what this formula shows you is answering the 911 call only, period. There's other things that police department needs, like warrants, record keeping, MDT loading. and some other variables that are specific to law enforcement. So that's why you see the 90-10 up top, because law enforcement actually call for a higher demand on resources of a dispatcher versus fire and EMS. So what we're showing you here is just answering the 911 calls. Some of those additional requests, so say we meet with Hiram PD, Manaway PD, Garrett, it doesn't matter, and they do need additional services. Those are things that are going to have to be worked out in additional to this cost in the contract, because those are when you start actually increasing the work demand on the dispatcher. So I just want to make sure we had 100% visibility that this just represents answering and dispatching the 911 call. So as we continue to have those conversations, we'll have to work some of that out with our prosecutor's office, and as well as finding additional ways to charge for those additional services to make sure it's meeting our needs.
Dan, you feel that your dispatch center is in a position to take this on?
Yes. Yeah, we're already, we're a primary PSEP. So by default, the state already requires us to have emergency medical dispatching certifications. So all my dispatchers have that. They're already dispatching law. So for Hiram PD, that's not an issue. We're going to do some background training just to get everybody on board. Some of us in the room already come from some fire EMS backgrounds, so it's that's not going to be a culture shock per se for a whole lot of people. But I feel comfortable with it at this point. On top of it being the right way to go, I believe so.
Okay, thank you.
I think what we're looking for today is not any resolution or anything, but just agreement from the Board of Commissioners that we should move forward and go have the conversations with the communities that are going to be looking for dispatch service at the end of the year and make that transition happen if possible. It'll all have to come back on an agreement by agreement basis for consideration by the commissioners.
So the approval point for us formally is on the contracts that get set up with the individual communities, right?
Yes.
Okay. I appreciate all of the work that you guys have put into this in a tight timeline. And it seems like the cooperation level is high among Portage County communities, which of course you like to see, especially with something as important as this. And the delivery of services seems like it will be improved. So I certainly support you moving forward with those conversations and look forward to, the future part of the process where, we're doing a formal approval. Hopefully you all can get us to that. But thank you for the work you've put in here, and I support you moving forward.
And I do as well.
Yes, I agree.
Thank you.
Thank you guys. We appreciate that.
Thank you very much.
For all your hard work.
Yes.
Hopefully we'll see you soon. Thank you,
Uh-huh.
everyone.
Make sure you quit sharing your screen, Dan. Thank you.
Thank you guys.
Thanks, Dan.
Okay.
Do you have any other items?
Maybe some discussion about the Board of Elections. Monday was a very crowded entry point, and there were, from my observation Monday morning, it seemed like most people were tolerating it well. I didn't see any anger, and most people were wearing masks. And the only thing I could say, if I could wave a magic wand, is we were probably getting a little closer than 6 feet, but part of that is issues that maybe we can look at.
Yeah, I appreciate all that our staff has done working with the board. I know Joanne has been heavily involved in how you all set that up. I wanted to talk to you. I know we all received the email about access to restrooms. And one of the things that Jean and I talked a little bit about was bringing in some portable restrooms to put out sort of an entry to the bullpen for early voters so that we don't have people who, are waiting in line and not able to access a restroom. And I think that would be a CARES eligible expense. Jean made the point that we could roll them in and out of the garage so they're not out overnight and potentially targeted for vandalism. And we can have a service agreement that would have them cleaned. I would advocate daily, especially with the COVID, but to give that option, because technically the way it's set up, and it is set up carefully and I believe safely, but you wouldn't hit the access to the restroom until your way out. So if it's okay with you all, I'd like to have a discussion with Terry and Faith and offer to help with that. Also, I think marking the 6 feet distance, there's some markings definitely inside, but increasing that for outside. I don't know that we'll have a line like we did on the first day. I think excitement's high on the first day for a while, but we'll probably have that again as we get closer to the election. So just to try to, model best practices and keep people safe, and we can use temporary marking so we're not, permanently marking up the parking lot to confuse cars coming in and out. And then the final piece I think we should think about is potentially tenting for the line in case the weather's bad and it's raining. So talking to the board about potentially renting some type of tenting. I wouldn't want to enclose it because then you get into the issue with COVID again. You're basically in an enclosed space. But if we have the roof covering with the sides open, at least people would be protected from
the elements.
Exactly, rain, maybe not high wind, but hopefully we don't experience that during the voting hours.
You could get snow. So.
Let's hope it doesn't snow, but that's a good point. But yeah, so if it's okay with you all, I'd like to engage in that with Joanne, and again, working with the board. And Joanne's done a good job with her staff of helping get this set up. And I know Ryan and Jean and during the CARES discussion worked with them as well, but let's see if we can help them with that additional piece.
Jean,
I think we'll be in a better position.
Yeah, I thought you and Joanne had already talked to the Board of Elections about tents. I thought you were the one that had originally brought it up in using the CARE funds, because we figured with the 6 feet distancing, we knew that line was going to be out the door. So I thought you had maybe already approached that with them.
We had, and I can say with some degree of certainty, there was not a lot of support from the Board of Elections. And I think their thought process was going to be like it was before. People would come in and go down the hallway and line up. The problem with that is employees still occupying the building need to come in through the bullpen, as you did this morning. And then there is a choice to be had if you don't want to walk through that bit of a plexiglass gauntlet. You could use the back stairwell, come up a flight of stairs, enter and use the elevator to come on up whatever floor you want. That is still an option. The other thing that became a point of concern was the issue relative to, and I'm going to see if I can do some high tech here. I don't know whether you can see that or not, but those are actually concrete cylinders holding the tent in place at Water Resource, because the concern was about driving stakes and damaging the parking lot and all the things that can go with that. I think that we can do that if there's a desire to do it. I know Joanne supported it. Ryan and I supported it. It just, I think it kind of fell on, we're going to do it a different way. And now we realize we can't. That probably is worth revisiting again.
Yeah, because I know I talked to someone that their 88-year-old mother stood in line with them for an hour and a half. And I asked the Board of Election, what was the delay? And they said the problem is a lot of these folks had requested absentee ballots that didn't go out till Tuesday, but then they were showing up to vote in person. So then they have to go through this whole process to remove that and stuff so that there's not double ballots.
Yeah.
And that's really what slowed it down. Now, I know yesterday and today, it seemed like the line was moving pretty good, but
Is there still a line today?
not this morning. It was within the building by the elevators. So no. Yeah. Like you said, I think the first day there's a lot of excitement to do the in-person voting, but I'll keep an eye on it. I'll be here for a while, so.
I feel like it should die down now, but then as we get closer, that's when it kind of picks back up. So I don't think that the Board of Elections wanted tending, but I think that if we approach them saying we'd like that, we've heard some complaints, I think they'd be willing, now that they've seen a line, to do that. That's my hope. So I just wanted to talk it over with you all, and try to move them forward with doing that. And I don't think the funding should be an issue. I think we can cover it with CARES, and it's just the right thing to do for our people.
We don't want 88-year-old women out there in the elements if it's raining and stuff and waiting.
Right. Or the disabled veteran that we heard from. Yeah. So it sounds like we're in agreement informally. So I'll just talk to Joanne and have her continue to work with the board, and hopefully we can move this forward. And I don't think it's an issue for rate now, but I'd like it for when we get closer. I think the restrooms, let's get those as soon as we can. These days will go quick. It's hard to believe that it's October 8th. But let's get this in place and work with them. And I am hopeful they'll be cooperative, and I think they will be.
Yeah. Okay.
And that was it.
All
So
right.
you didn't have anything else, did you, Jean?
No.
Okay.
I'll make a motion to adjourn then.
Second?
Roll call, Amy.
Sabrina,
Yes.
Vicky,
Yes.
Kathleen.
Yes.
All right. Thanks.
All right. Take care, everyone.
Thank you.
Thanks.